How does hypertonic saline help with your TBI patients? Well, let me show you. Quick recap on your TBI patients. Remember, your brain sits inside your skull. That's obvious. But what happens in a TBI patient, an increase in intracranial pressures, what happens is we have fluid escaping from the intravascular areas, these areas here, and escaping the extravascular areas. And if we have enough fluid accumulation in this extravascular area, it's going to start putting pressure on the brain, ultimately increasing your intracranial pressures and causing severe problems with your TBI patients. So when this occurs, what happens is we're going to give a hypertonic saline. And what it basically is going to do is that we're going to increase the sodium concentrations of your intravascular fluid, okay, in fluid inside your vessels. But what we know is that high concentrations of solute or sodium means that water and plasma is going to follow. And so if increasing the vascular sodium here, what's going to occur, because we know that the fluid accumulation is in this area, having that increase of sodium here is going to manipulate this fluid, this excess fluid in the extravascular area, to shift back into this intravascular area. And then now we can transport it out of the brain and reduce the ICP. That's why we use hypertonic saline in TBI patients with fluid accumulation.